get a SICOT fellowship is a yearly subscription of €150 to become a SICOT international member. This not only includes an opportunity to be applying for a fellowship, but also gives you an access to international orthopedics, both in print as well as online, and a free complimentary access to the SICOT International Conference every year. The classification, if you look at the SICOT fellowships, there are certain short-term fellowships for 4 to 6 weeks, and there are certain long-term fellowships from 6 to 12 months. If you look at the short-term fellowships, and the best one I would recommend is the SICOT meets SICOT fellowship, 4 to 6 weeks, up to €2,500 as travel and accommodation charges, and you have almost 50 positions available. The Ganga fellowship is a 4-week fellowship, €1,500, 4 positions available. APOA SICOT fellowships, 2 to 3 weeks. This is a collaboration between APOA and SICOT. €1,000 traveling expenses, 2 positions available. For the spine guys, the APSS SICOT Spine Traveling Fellowship, 3 weeks, €2,500 and 2 positions available. The German SICOT Fellowship, 4 weeks, €2,500 available. 2 best exam candidates, that is the people who top the SICOT diploma exam, will get that. As regards the long-term fellowships, we have a Texas Children's Hospital Fellowship, 12 months. This is a research fellowships with $56,000 as a salary and a plane ticket. SICOT International Traveling Fellowship, where you can choose a center of excellence where you want to go. SICOT pays you €4,000 for that. It is for 3 months. The SICOT Danish Fellowship is again for 3 months, €2,500 plus travel. The PKU Shenzhen Fellowship, 1 to 2 months, up to €1,000, 10 positions available. And the Hong Kong SICOT Fellowship, 12 weeks, €600 plus a daily allowance from these centers and 2 positions available. Now, the requirement to apply for a SICOT fellowship is that you have to be a SICOT member for 2 years by paying all your dues. Your age should be below 45 years, but now they have had a few senior fellowships. So even if you're above 45, they are going to be starting fellowships. You should have good communication skills in English, that is very important. But most important is a very strong CV with international publication, at least 1 or 2 as first author. That really gets you the brownie points. And your entire immunization history from the day you were born is something which you have to maintain from now, because that is asked by most countries today in addition to the COVID vaccination. What do you expect from a short-term fellowship? You get a brief overview of the specialty, observe surgeries, you don't get to operate, observing patients in outpatient department, learning some novel technique and refining your technical skills if you're slightly on the senior side, and an opportunity to network and establish contacts. From the long-term perspective, if you're looking at a long-term fellowship, deeper perspective of a subspecialty, some centers allow you to wash up, that you can always confirm. You can learn the art of clinical examination and patient care, which varies from region to region. Develop a new skill set, write and publish papers, extremely important, and you get an opportunity to develop long-lasting relations with mentors and get to interact with role models and people coming from different countries on various forums. This is the SICOT Meets SICOT Fellowship, which I availed in 2020. So I went to the Texas Children's Hospital, where I worked for some time with the hip dysplasia unit, the CP unit, pediatric hand unit, and also visited their research facility, and also had some time with the pediatric spine unit. So to summarize, SICOT fellowships essentially are about learning. They are about evolving from being an orthopedic surgeon to somebody who's at a global level and who is working shoulder to shoulder with people all across the world. And most importantly, you also get some time of your own to enjoy yourself. Thank you so much.